Good morning, everyone, and welcome back to Dashboard Dissections Cosmetic Surgery Edition. Here we are on yet another lovely commute, and I was thinking last night, because I didn't sleep very well, I was thinking about what we should talk about today, and I thought that, I've devolved into not very medical things for the last couple of episodes, mainly because I've had a ton going on in my personal life. And of course, I'm one of those people that has to talk about it nonstop because, I might suffer a little bit, but you're going to hear about it. So, today, I thought we would talk about liposuction. I've had a couple patients who have been, really surprised by parts of their liposuction recovery. And I feel like, and I tell almost every single one of my patients this, I feel like my entire job is to give you information. And with that information, you make an informed decision on what you feel is best for you. And some of that is, which surgery do you want or need for which goals? Some of that is what recovery is feasible for you. Some of that is risks. Some things are too risky to do for, the benefit of what it can give you. And so that's job number one. Job number two, once you've decided on a surgery, or we've decided together that a surgery is going to be what you need, my second job is to give you, again, more information to make sure that nothing throughout your recovery process surprises you. That's my main goal. When someone books surgery with me, I don't want anything to surprise them. And I've said this before, and maybe it was not on the internet, but I feel like, myself included, I remember, and most people remember, anywhere from 20 to 30% of what is said to them in a high stress situation or a doctor's appointment. And so that makes it more difficult. But with me and the way that our offices work, you'll hear it at least twice, probably more than twice, but you'll hear it twice. It's written down for you. So in theory, that 20 to 30% should go up, right? Because then we've got visual learners, we've got auditory learners, and we've got people that read to learn. Now, the people who experience it to learn, y'all are going to get there, but I can't do that for you beforehand, unfortunately. So I try really hard, no matter what surgery you're undergoing, to make sure that nothing during the process surprises you. And I will even say that during the consult. People tell me constantly, okay, maybe not constantly, but a lot. People tell me a lot that during a consultation with me, they get more information than they got elsewhere. And I am a very thorough, detail-oriented person, shocker. And so I find that I tell people the information that I would want to know before I go into surgery. And I also try to tell people things that they're going to deal with that might shock them after surgery. And liposuction has a big one. So, there's something with every surgery, right, that happens that you as a patient freak out about. Rightfully so. You're not used to it. No one told you. Or they did and you didn't recall. And so, that panic is normal. And then you call with this, very anxious thing, and you talk to someone at the office, you talk to your doctor, and they're like, oh yeah, no, it's fine, it's totally normal. Oh, okay, now I have to calm my anxiety back down. And sometimes, and I know this happens to me, I'm talking about me being a patient, not me being a provider. Me being a patient, if that happens, it's very difficult for me to bring myself back down, especially if I feel like someone in the office didn't listen to me or understand what I was saying, or I felt like they had already made up their mind that was the response that they were going to give me, no matter what I said. that always makes me panic a little bit more. And so I know, because I am that way, that some patients are that way. So liposuction's big thing. Okay, I'm driving south today. Well, technically, I think I'm going east because the sun's in my eyes. See? Not just a cosmetic surgeon. Got a little brain in here too. So I'm going to be staring into the sun, but at least y'all won't deal with the glare. So, it'll be fun for us both. Anyway, liposuction's big thing after surgery that scares the crap out of them. There are two. Number one. So there are two things after liposuction that surprise everyone. Number one, right away after surgery, you look and feel bigger than you started. You feel bloated, your skin feels stretched out, you overall have the same body contour that you started with, but now you're in pain. And it sucks. And you're in a tight compression garment, and it sucks. That's very normal. And it's the way I describe it, the best analogy that I have, and y'all know I'm huge about analogies because I think they just make things more clear. The best analogy that I have is a sandwich. Okay, and I talk about the trunk. I talk about the trunk because that's the most common thing that I liposuction. I liposuction everything: arms, breasts, back, front, legs, neck, face. So, which, whatever. But I talk about the trunk mainly because that's what I do the most commonly. So your abdominal core, and basically from the muscles out to the skin, I describe as a sandwich. Every med student knows that the layers of the abdominal core is a common pimp question during general surgery or any belly surgery rotation. Okay, so I break it down to a sandwich. It's so much easier than like the 8 layers. And then all the different things based on above or below the arcuate line, medial or lateral to the semilunar line. Anyway, it's a sandwich, okay? So the top layer of the abdominal core, which is the rectus sheath, is the bottom layer of our bread. All the fatty tissue in between is the meat and cheese and toppings. And then the skin is the top layer of the bread, okay? So we've got our sandwich, right? Now my whole job when I'm doing liposuction is to take out the meat, cheese, and toppings from the sandwich. Okay? So I'm left with 2 slices of bread that I need to become like a grilled cheese. Okay? And the body naturally, when a space is created, which is exactly what has happened with our sandwich. I've taken all the meat and stuffings out of our sandwich and left you with 2 flopping pieces of bread that are far apart. I've created a dead space. And the body naturally fills that with fluid. And I also fill it with fluid too, which I'll get to in a minute. But the body naturally fills that space with fluid. And that fluid contains building blocks to heal. What can happen if you don't get rid of that fluid or prevent that fluid from building up in that area is you can get what's called a seroma, which is a fluid collection. So fluid can remain in that area. Sometimes a fluid collection is part of the normal healing process, and sometimes I need to drain that with a needle in the office. You don't need to go to sleep for that. It's not super comfortable, but it definitely gives patients some relief right after it's done. But, smells like burnt rubber. Somebody was drag racing. Woo-hoo-hoo. Sorry, that was aggressive. Not quite to the point of smelling like a skunk, because as you guys have heard, I feel that a skunk smells a little bit like burnt rubber and tar, just a little. Anybody who's smelled it before knows what I mean. And I'm sorry that you're part of the club that I never wanted to join myself. Okay, back to liposuction. All right, so that fluid collection, sometimes I need to drain with a needle, but sometimes it can persist. And if that happens, it can create a wall around it and become what people commonly call a cyst. This is technically called an encapsulated seroma, meaning it has a thick candy shell, as Tommy Boy would say. And that shell will continue to make fluid. So if I pop a needle in and drain it completely, the body's just going to be like, boop, we're going to fill it back up, because that tissue is going to create fluid. So the treatment for that, the ultimate treatment for that, is to cut it out There are some people that will do therapies where they inject stuff in there to try to, rough it up and close that space down. But ultimately, the best treatment is to cut it out. So an encapsulated seroma, and that can happen because fluid builds up in the area and isn't adequately drained. But that's why right away after surgery, you're not going to see the results of liposuction, and you shouldn't. If you're seeing the results right after a liposuction or a body contouring procedure, then what you're doing is probably just dehydrating the cells, shrinking them down, fat cells. Fat cells, as I'm sure everyone has seen, because, these things go viral, fat is not very dense. Muscle is very dense. And what that means is a pound of fat is a lot larger than a pound of muscle. Okay? And that's because fatty tissue doesn't have a lot of substance. It's mainly just water. So if you dehydrate those cells, sure, they're going to shrink up, they're going to go away, but you're not doing anything to affect them from filling right back up with water when you take another sip. So that's why when you're dehydrated, you look skinny. Pro tip, dehydrate yourself for your body contouring. Just kidding. Don't do that. That's a terrible idea. That was a joke. PSA, that was a joke. Don't do that. But those wraps, that's what it does. Those body wraps that you used to put saran wrap over the top that were a really big trend. I want to say, I think it was in 2010s, that time frame. But that's what those do. They dehydrate you, so you get that contour, but it comes right back because your body needs water. So that's thing number one, is that you don't have a result right away. Your body contouring, it takes about 2 months. I usually tell patients this too for everything. It takes about 2 months to see approximately 80% of your final result. From 2 to 6 months, you're going to see the majority of the rest of that result. But honestly, you don't see 100% of your surgical result, meaning all the swelling is gone, everything is perfectly healed, scar tissue has transitioned over to that final type of scar tissue, that type of collagen that will stay forever. That doesn't happen until about a year after surgery. And that's more applicable to the face, because swelling in a smaller space, especially a rhinoplasty, you are not going to know what your rhinoplasty looks like which is a nose job. You're not going to know what that final result is until at least a year after surgery. And that is really, really hard, especially as a surgeon. I love instant gratification, right? I went into surgery because I remember a day, I think I talked about this already, but I can't remember if it was, again, screaming into the void of the internet or if it was in my personal life. But I remember going into surgery because I had a patient as a med student that came into the ER with appendicitis. I saw him, diagnosed it, got the OR ready. Of course, I was a med student, so I didn't actually do the case, but I did the case. Saw him the next morning and discharged him. And I was just like, that is so cool. I saw a problem. It was a problem I could fix with my hands. I did that. He got better and he went home. That was awesome. Right? So I love instant gratification as much as the patient does. But a patient that is doing cosmetic surgery, 8 or 9 times out of 10 really wants a result. I guess that I should say more than 9 times out of 10. 10 times out of 10, they really want a result. But 8 or 9 times out of 10, they want a fast result. And liposuction ain't it, boo-boo. Liposuction takes a minute. So during surgery, this is coming around to thing number 2 that surprises everyone about liposuction. There is a significant amount of fluid drainage from small incisions. Liposuction is small incisions. Okay, let me backtrack. I was just saying I'm coming around to it, but I'm going to backtrack for a second. So a liposuction surgery is where I use a cannula, basically a long tool with suction to suck fat cells out from underneath the skin to provide better body contouring and decrease the amount of subcutaneous, meaning below the skin, amounts of fat. women naturally carry our fat more in the subcutaneous layer, meaning above the muscles, below the skin. That's why women bodybuilders have a much more difficult time getting that definition. That's why it's so impressive when they do that, because it's much, much harder for a woman. Hello, sun, and good morning to ya. But women carry our fat there. That's why women tend to respond to liposuction a lot better than men do. Now, men, sorry, hi, welcome to my visor. It didn't help at all. So there we go. But women tend to respond better because that is the area we tend to carry our fat more commonly. Okay? Men tend to carry it inside their internal structures, which is why men with like toned arms, that's why Thor, when he had a big beer belly, still had big arms, right? I know that was fake, right? Chris Hemsworth could never look like that. He would never do that to us. But that's why men with like defined biceps can still have a big beer belly, because they carry their fat inside with their organs, and that's why they get that big round belly. Okay, that is a more common space for men to carry fat. Now, a lot of this is genetic, partially. A lot of it is hormonal, which is why men versus women is different. And so hormonal therapies and hormonal blockers, cancer treatment can change all of this. And again, genetics plays a role in how you carry fat. That's why, like, for me, my mother and I carry our fat in our faces, thanks Ma, and my muffin top. That's where I carry fat. Not like a normal woman in my hips and thighs. No, 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 no. Right in my face so you can see it. And right on top of my, the old muffin top, the old fatty tire. Okay, anyway, this is not about me. Okay. So that is what liposuction does. I perform this by using small incisions. It's about the size of a grain of rice. There are usually 4 on the front, 3 to 5 on the back. Again, I'm talking about the trunk going all the way around because that's the most common liposuction area that I do. And then I put fluid in, and that helps increase the size of those fat cells. So I am flooding those cells to make them bigger, and that makes a bigger target for me to go at with the cannula to suck that fat out. Okay, it also does 2 other things because I add medicine to that fluid. It helps numb the skin and it helps decrease your bleeding risk. Okay, so I put that fluid in, I let that sit for a minute, and then I start with the liposuction through those same incisions. I use a vibrating suction-assisted liposuction handheld device. You can change out the cannula, meaning the straw that applies the suction that goes under the skin to suck the fat out. You can change that diameter. You can change the openings for sucking out the fat. You can change the way that it vibrates. The big thing with Air Sculpt right now is that it's compressed air that is causing the vibration of the device, and B, that it does a different motion. Instead of my device goes up and down just really fast, vibrates, and sucks. Don't go there. Okay, don't go there. It's a family show. All right, we're talking about liposuction. Keep it clean, okay? I know some of my friends that are watching are going to give me a lot of crap for what just happened, okay? So don't feel like you have to, but you can. Welcome. Welcome. Just pile it on. I can take it. I promise. Anyway, that's the way that my device works. Air Sculpt does like a circle motion while it vibrates and sucks. Again, it's a family show. Okay, so we go in under the skin and we take all that fat out. Okay, as it comes out, whatever, great. It sounds great. So because of that fluid that I put in, and I put in usually for a 360, a trunk kind of, and I describe that as bottom of the bra to top of the underwear all the way around. Okay, that's the surface area that I'm talking about. And we call that a lipo 360. Shocking, what a name. I'm really original. Thank you so much. But that area is huge, okay? And I am banging up against the muscles, I'm banging up against the skin, I'm banging up against the nerves, and so it hurts. It's a painful surgery. Most women describe it as like they went to the gym way too hard, way too many days in a row. That and your skin just feels like stretched and swollen and not great. You feel bloated. And then, okay, so I'm coming around to thing number 2 that surprises everyone about liposuction. Thing number 2 is because of the fluid that I put into your body and the fluid that your body creates to fill the dead space, the void that I created, you are going to drain a red watery fluid. I always describe it as 2 things. It looks like red Kool-Aid. It looks like the Kool-Aid man tried to run through the door and shattered instead of leaving the Kool-Aid man-sized hole in the door and went everywhere. That's coming out of your body from small incisions. Like I'm holding up my pinky nail because I say it's like the width of my pinky fingernail, the size of a grain of rice. And from those incisions, you are pouring out like a giant man-sized pitcher of red Kool-Aid, okay? And patients who don't expect that think they're dying, right? Who wouldn't? You are leaking a red watery fluid, like liters of it. Yeah, that's terrifying. And if you're not expecting that, or if the person taking care of you is not expecting that, they're gonna think you're dying, right? I would too. Okay, so this is the thing that surprises everyone. So you drain about half of the fluid that I put in to help increase the size of those target cells. You drain about half of that from those small incisions. The other half either gets absorbed by your body or I suck it out with the liposuction. Again, family show, y'all. Okay? Get it together. Keep it together. Head out of the gutter. Okay. So those are the 2 things. Number 1, that the results are not instant. And number 2, that you have this red watery fluid drainage. And it can happen for up to about 3 days. I always tell people it's anywhere from 1 to 3 days that you're going to deal with this water fluid drainage. Now, there are a lot of nice things about liposuction, which we can go into in another day, but I do want to start talking a little bit about the utility of a lymphatic massage because of this amount of fluid that you're dealing with and the fluid that your body is creating throughout the healing process. So your overall recovery from liposuction, there's not a ton of restriction. It's not like a tummy tuck where I tell you not to use your abdominal core, the thing that Pilates teaches us to use with everything we have. It's not like I'm telling you not to lift anything or not to do anything or to take it really easy. No, none of that. You really don't. I recommend no rigorous activity or exercise or anything that raises the heart rate, blood pressure, or makes you short of breath for 1 week. After that, let your body dictate what feels comfortable and what is appropriate. Your body's going to tell you what's a yes and what's a no. There are 2 things that you have to do after liposuction. I guess the third thing that really surprises people is that I tell them that their recovery process and what they do to take care of themselves after surgery is at least half of their result. Half. There are very few other surgeries, not none, but very few other surgeries that require so much patient involvement in the recovery process as liposuction. So it's an investment of time from you and financially, obviously, but 2 things that you have to do after surgery to ensure you get the best result possible. And both of these things are targeted at decreasing the risks, which are fluid buildup in the area. Again, hello, welcome to my visor. This is where we're at today. But 2 things you have to do after surgery. There's a lot of 2's with liposuction. Maybe that'll be a new thing I talk about. Anyway, 2 things that you have to do for your recovery to help maximize your results. Number 1, wearing a compression garment on whatever area we liposuction for 24/7 for 8 weeks minimum. At 8 weeks, I tell you, you can start to be out of your compression garment as needed. I recommend at least 12 hours a day still in your compression garment. So either during the day or while you sleep, whatever's most comfortable. Most women and men find their compression garment more comfortable during the day. And so they sleep without it and they wear it during the day under their clothing. Now you can do whatever you want. I've had some patients, especially patients who are extremely concerned about excess skin after liposuction, which we can get into in a minute, but I've had a couple of patients who just keep wearing it 24/7 for like the full 6 months. And that's fine. The more you wear it, the better your results will be and the faster you will see that result. The goal of compression, the reason that it's so important is, like I said, that fluid buildup in that dead space we created. You want to compress those slices of bread together. You're making a grilled cheese, mama. You got to put the little smusher on there. Obviously, I don't cook. What's the thing that makes the smash burger, the little weighted thing? Whatever. Put that on there. That's what we're doing. We're closing the dead space mechanically with pressure. So that will help decrease the risk of fluid buildup in the area. And your compression garment needs to be your best friend. You need to wear it 24/7, like I said. You need multiple of them. And there are multiple stages, which I think I've gotten into a little bit. But as you start to get to that final contour, you're not going to need the same size as what you started with. So most people talk about 3 stages. The first stage is basically the same size or slightly larger than you are. The second stage is obviously the middle ground, and that usually is reached anywhere from 2 to 4 weeks after surgery. And then the final stage is kind of your final contoured shape, and that's usually 1 to 2 sizes smaller than what you started with, depending on the sizing of your compression garment. So I try to prep people for buying a few compression garments because you're going to need them, and then they're not going to work for you after a while because you're going to get smaller. You're welcome. So that was thing number 1, compression. And really that, like I said, stops any fluid buildup. It decreases the amount of space available for your body to fill with fluid. Thing number 2 is what I was trying to get at when I started this spiel: lymphatic massage. So thing number 2 that you're going to have to do after liposuction surgery is massage the areas that we liposuction. I recommend with your hands, at least for the first 2 to 4 weeks. With your hands, or someone else's, whatever. Again, family show. Okay, family show. So for 60 minutes a day. Again, an investment. I realize that completely. But what this is going to do for you is exponential. Okay, so what it does. Number 1, it mechanically moves the fluid around, kind of stimulating your body to remind you that this fluid is here and it needs to be taken care of. Okay? Thing number 2 is that pressure is going to activate the lymphatic system, which is your body's natural fluid recycling system. It's going to stimulate your lymphatic system to start recycling this fluid. And how it does that, the reason that if you've ever had liposuction with me and you've called into the office with almost any issue after liposuction, almost any issue is related to your hydration level. And the reason is liposuction, with the fluid shift that I caused by putting that fluid in, your body creating that fluid, it's called 3rd spacing. Okay? There are 2 spaces where water is supposed to be, in your blood vessels and in your GI tract. So those are spaces 1 and 2. Okay? 3rd spacing is a generic term for water or fluid being in a space where your body cannot utilize it appropriately. Meaning, if there's extra fluid in your lungs, that's 3rd spacing because your body cannot utilize that fluid for hydration or lubrication like it needs to. Again, a family show. All right? So, 3rd spacing, what happens in liposuction is your body creates all this fluid to put in this space. I put fluid in this space, and that changes the chemical components and the ratio of chemical components from the blood to this 3rd space, this new space that has fluid that doesn't normally. Okay? And these chemical components, and most importantly, the ratio of these chemical components, it's called osmolality, right? Science words, super fun. Throwing it all the way back to chemistry, y'all. It is actually important if you're a pre-med student watching or listening to this. It does play a role. Not organic chemistry, right? Like, I'm not a psycho, okay? That was just torture for no reason. Anyway, I digress. That's a different soapbox for a different day. So this ratio of chemicals between these 2 spaces is what causes water to move within your body. Okay, so that's why Gatorade, when it came out, was such a big deal. When we sweat, we lose chemicals, not just pure water. Okay? And so as you do that, those chemicals are coming from your bloodstream, decreasing the amount of these chemicals. We'll call them electrolytes because technically they are. You are losing electrolytes through your sweat, and that those electrolyte changes within the bloodstream change that ratio, okay? And that causes fluid to move, water to move within the body between one of the two main spaces and third spacing. That's why after the gym, you can look more bloated. That's why your muscles tend to get a little bit bigger, because water is moving as you dehydrate, okay? So with liposuction, I am putting liters of this fluid into this third space to do the things that we already talked about. And that changes the ratio. So your body naturally pulls more fluid into this third space to try to even out this ratio, to bring it back into balance. Your body is 100% a machine built on balance. And balance within physiology is called homeostasis. Okay, again, it's a family show. Homeostasis is a science word. Thank you. Your body is naturally always trying to get back to a state of homeostasis. Okay, and so fluid is moving around in your body, and it's this third space fluid that I created, that your body is perpetuating because it's trying to heal, is pulling that water from your blood vessels in order to normalize that ratio of electrolytes between first and second space and third space. Okay, so your body is naturally losing water into this third space constantly during your recovery. So taking in oral electrolytes and water, but mainly electrolytes, is so important, because we need to denormalize that ratio and in fact flip it. So we need electrolytes in the bloodstream to pull that water from our third space back into the blood vessels so that it can be filtered through our kidneys. And you'll notice after liposuction for the first week or two that there will be days where you pee a lot. And that's all that is your body is exercising the demons. It's getting rid of all that extra fluid. But the only way that can happen is by pulling that fluid back into the vasculature. And so your body is naturally dehydrating itself after liposuction. That's why almost every single time you call the office or talk to me or my partners after a liposuction procedure, the first, second, third, fourth, and fifth question that we're going to ask you, and the first, second, third, fourth, fifth, sixth, and seventh thing we're going to tell you to do is drink more fluids. Gatorade, Powerade, Liquid IV, anything. If you don't like those things, take a tablespoon of salt and chug some water afterwards. Take some salt tablets, take electrolyte tablets, anything to flip that ratio, to pull that fluid back in and normalize your body without dehydrating your blood vessels. That's what is happening inside. That was a whole lecture on osmolality, third spacing, and homeostasis. Y'all. I tried to make it fairly clear, but it is a very complex, very difficult theory to realize, and it is very nuanced. It's very specific to each person, as everything is. But that's why a lot of times patients call with a headache, and that's dehydration. Muscle cramps, dehydration. So things that you're not expecting after liposuction are usually related to your body being dehydrated. And that's the reason that if you call the office or, talk to me or my partners, you're going to get irritated because we sound like a broken record. But that's the reason. Your body works against itself because of its natural state to get back to homeostasis based on a change that we created. And you have to flip the script in order to be effective. Lymphatic massage really helps because it stimulates, as I said, your body's natural fluid recycling system to bring that fluid back. The goal of the lymphatic system is ultimately to bring that fluid back into the vasculature, just in a different mechanism than electrolytes. It works via a different system. So using both of those systems is more effective. And a lymphatic massage is not like a deep tissue massage. Lymphatic vessels, which I think I have talked about this before, screaming into the void. Lymphatic vessels are very, very thin and flimsy. They don't have a muscular wall. So if you press too hard, you will occlude them, and that will back everything up. So it's a light pressure massage, and sometimes it doesn't always feel like a light pressure massage, especially like right after liposuction, because it's a different tactic when your body has fluid built up in the area. But this is just a general lymphatic massage. If you go for one thinking, oh, this will be nice and relaxing, it is. It absolutely is. And it can help filter out toxins. It can help your body feel more hydrated because, like I said, the lymphatic system drains into the vasculature system to put that excess fluid back into the first and second space from the third space. So this is a twofold way to help your body get back to homeostasis in the right way without dehydrating yourself and dealing with the effects of dehydration. So lymphatic massage is exceedingly, exceedingly important after liposuction. It also can help with contouring. It also helps avoid any firm nodular spots because as fat dies or loses blood supply, it calcifies, and that can get hard and firm, and you can feel that underneath the skin, and massage can help decrease that. So massage and compression are vital, and hydration are the three most vital things after a liposuction procedure to maximize your results and minimize your pain and suffering. So there you go, 3 and 2. That's all it takes. You know, it's so easy. I'm just kidding. It's absolutely not. It's a lot of work. It is a lot of work. And it's a tough recovery process. People say that liposuction is one of the more painful things that I do. It irritates nerves, so you can have nerve pain, it bloats, it does a lot of things. But yeah, that's liposuction 101 or 302 or 3 and 2, whatever. That's my take on liposuction. That's my spiel. And actually, y'all, I almost missed my exit. I was so gung-ho about this talk, and now I'm making this beautiful drive, and I'm almost to work. So I hope y'all enjoyed this wonderful episode of Dashboard Dissections Cosmetic Surgery Edition. And if you're interested in liposuction, definitely don't wait until the last minute. I also know that there are a lot of non-invasive or less invasive options, or awake liposuction, which again is a whole nother topic for a whole nother day. But nothing is going to be as effective as permanently removing the fat cells, which is what liposuction does. They've tried multiple other options. Nothing works as well. A lot of them require multiple treatments to get a result, and that result is usually not as significant as liposuction. So while I know a lot of people are very concerned about going to sleep and having a procedure like that, it ultimately is the best and most final way to contour the body and permanently remove fat cells from any area that you want removed from. So come and see me if you want to talk about an area or options that you may have. Sometimes it's skin and not fat, and we have a different discussion. But liposuction is a fantastic procedure. If I could do it on myself, I probably already would have, but we'll see. Maybe someday. Yeah, it was great chatting with y'all. Thanks for keeping me company on this drive, and I will see you next week.